just kia tauna manaakitanga te me ngaro, ki runga, ki tēnā o tātou, kia mahi e te hui e mā kihi, kia toi te kupu, toi te mana, toi te araha, toi te reo Māori, kia tūturu ka whakamaua, ki tina, hui e tā hiki e. So good morning, everybody. It's great to see you all here. I've got a bit of a smaller group today, so we might not go for the whole time, but that's fine. You know, when it's cold and people have got illnesses, etc., sometimes people just can't get here. So I'm Linda Cooper. I'm facilitating today, and I'm the chair of Waitakere Health Link, who run the forum. Just to advise everybody that we are recording the presentation so that we can post it online, and I'll run them in the order of the agenda, and I've just added in Yasa from Wellbeing Kahui Te Kaha, and he'll go at the end of Mental Health Social Services. I'm going to add something towards the end as well, just to talk about whether you think have a think about this while we're going along. I know Paula Seymour's sort of talking to us and saying, like, would it be worthwhile doing another in-person forum in the hospital, as we used to do, and mix it up a little bit during the year. So we might do some of these and some of, you know, in person, especially once the foyer's up and running. So we can talk about that later, but if you want to put your opinions in at any time in the sidebar, please feel free. How we're going to run this is when we get to your group, so if it's long-term conditions, if you can put your virtual hand up, then you come up to the top so I can easily see you and make sure I run it in an orderly fashion. And if we just all keep our mute buttons on during, so we don't get any kind of feedback going on. So that's great. So thank you, everybody. First of all, we've got Paula Seymour here again, who is our GM Child, Women and Family Division at the hospital here where we're sitting, Waitakere Hospital, and the site manager for the hospital. And again, I want to thank her for being so fully involved with communicating to our community. It's wonderful. No matter what's been going on and the ups and downs, since we didn't have a DHB, she's been in contact with us, made sure we're up to speed, and being very willing, and now sits ex officio on Waitakere Health Link as we change the constitution from a DHB member to a member of Waitakere Hospital staff. So, well, oh, I thought I saw her join in.
Pauline.
Oh, Pauline. Oh. Paula, are you here? I thought I saw her. I'm just going to look at the.
Yes, I'm here.
Paula. Pauline's here. I thought Paula was here. It's just on 10:05 now, so she may get here. It's great to see. Got a lot of people here. So there's members of Waitakere Health Link on this call. So we've got Pauline Mitchell, who's our disability rep. Pauline. They've changed Zoom, and I'm just getting my way around it now. Where's our participants? Here it is. So if I look down the list, so we've just got at the moment me and Pauline, so that's great. Okay. So what we could do is any updates. So I'll start with a few general updates from us while we're waiting for Paula. So we have our HealthLink AGM, 1 o'clock on the 24th of September, Depai Courts, and we do have a guest speaker, Hector, and he's from Te Whatu Ora Health New Zealand, and he's in charge of community engagement. So that'll be a really good opportunity for us to ask him how he sees the voice of community, you know, getting back to the people that run our health system. So he's Director Consumer Engagement Whānau Voice Health New Zealand. And so that's the question we've asked him to speak to us about, because I think even a couple of years down the track, that is still really topical. There is a regional consumer council that has now been developed, and they're called for, but that goes for the whole region, right from the top, Cape Reinga, right down to including Manukau counties. And so that is a huge area, and it's much bigger than the previous consumer council we had that was Waitakere. The application process is finished. They haven't announced who's on it, but we do know from our intelligence that there is at least one person from West Auckland, and that's great. That's a relief. Looks like Paula is here.
Yep.
So I'll ask Paula now. That was just a bit of an update. So Paula, welcome. And we'll hand over to you for your discussion and feedback on community health service space in Waitakere Hospital foyer. If you can unmute Paula, that would be great. That is.
I'm just going in and coming in and out of my video, and mute are not working.
Ah, hang on. She said her video and mute are not working. So can I unmute that? No. Carry on for a minute. So the other update that we had was he's put it over the top of it. The other is that our youth mental health and wellbeing project, Samantha is getting a focus group together for September. August. So if anyone wants to join in that, please do, because the more voices around our youth mental health that we're getting together and working at how we communicate our needs and our status in the West is really important. So if you can just let Tracy know, or even put it in the sidebar if you want to be involved, and she'll send the information. It's not a highly formal thing. It's the first real get together to talk about the state of youth mental health in our area. Now, I haven't got Paula. We've got a bit of problem here. So what we could do, instead of just sitting here in silence, is maybe we'll just start with our long-term conditions. So if Disability Connect, Flying Kites, Hospice, ME Support Your Way, Kia Roa, can put your virtual hands up, that would be great. Whoever is here. Great, we've got Natalie. So it looks to me, I've only got 2 hands up at the moment. So we'll start with Sarah, saying she's first on the list from Disability Connect. Welcome, Sarah.
Kia ora, everybody. No, I'm not from Disability Connect. I'm from Flying Kites.
Oh, sorry, that's my
okay.
mistake.
It doesn't look like Disability Connect.
Your second, sorry. Flying Kites Disability Support and Sarah. Thank you.
Kia ora. No worries. Kia ora, everybody. Yeah, so Flying Kites, I don't know if you've heard of Flying Kites. We're only a very small charity, and we support disabled people and their families. We are all based in Auckland, but we have 3 different services at the moment, and one of our services is nationwide, so our recruitment service. We have a navigation service, which is Auckland based, and also a new Soaring Beyond School service, which is like a post-school transition service for school leavers. And I can briefly talk to you, if you want me to, about those services, just briefly. So our navigation service is helping families who are stuck or don't know where to go for help and support, where to find funding, and just generally lost in the system. And we help them to find the right things for them, and with any goals they have, we support them to try and achieve those goals. Our recruitment service, as I said, is nationwide, and we support families or disabled people to find their own staff. So families who use their individualised funding to recruit their own staff, we support them to find very individualised bespoke service to help them find that right person for them, and yeah, to help them with whatever they need support with. Support workers is mainly the kind of person we recruit. And our last service is the transition from school, so soaring beyond school, helping school leavers figure out what they need to do, how they can go find help and support, what's available in the community, what's available support-wise, funding-wise. Yeah, anything that they want help with, we help them to figure all that out.
Thank you so much. Thank you. Now, it looks like Paula's ready, up and ready. So, Natalie, we'll come back to you if that's okay. And Paula, over to you. Thank you very much.
Kia ora koutou, and significant apologies for that. I've never had that happen before, where I was pushing the mute button and the video button and it just wouldn't work, and tried going back in and out, so that didn't work. So I'm on a different device now. Thank you very much, everyone, for having me. I missed some of the conversation, but I am really keen to get this back into the hospital. I think we've had the Hector Trust, the market days back in, just the going foyer and in the front of the main entrance, and there's a lot more interaction as people are getting their coffee and walk past. So I think it will be a lot more visible to clinicians, and probably what we really want to discuss is how things could work.
Paula,
now,
can I just say,
am I coming across all right?
Paula says that your bandwidth is low, so you are a little bit. We can hear you, but I'm just wondering, your video keeps freezing. Maybe maybe I don't know if technical people know, but if taking the picture off, does that help? I don't know. Because you're sort of it's a bit slow. Now, try talking now and see what happens.
Yeah, please let me know if you can't hear me, because I can see a lot of frozen faces from my end. So this other device isn't quite as good as my computer.
Yeah, we can hear you.
Great, thanks. So although I haven't got the date, we've got the design. We're just checking in with a few other groups before we start the operational implementation to do the redesign of the front of house. And one of the things we really wanted to look at is the use of some area for NGOs, and if you wanted to have we wanted to pilot having you come at a certain time during the week. So for example, say 10 to 12 on a Monday, you'd have a slot where you were there and maybe have some information flags up on a service, or if there's other ideas that people have on how we could get NGOs and information on your services out to staff, visitors, patients within the hospital. So this is really part of a discussion and opening the floor up to how could we make this work, and maybe we try with a couple of NGOs first to see how it works.
Right, okay. Well, if anybody wants to speak, can just pop your hand up, your virtual hand up, and then I can see who wants to speak. I just had a quick question. I was thinking, I'm seeing Edith here from Maternity Services Consumer Council, and I think my understanding is most people don't enter the maternity services from that front entrance. And is it something with that would be really good to be able to have, say, maternity services or anything related, baby related, being able to be in that other entrance? I know this is throwing a curveball to you, Paula, but I just wondered whether, how many people would you catch in that sector coming through the front entrance? Don't know.
Yeah, I wouldn't have said many through the main entrance for maternity services. Certainly for child health, they do. They can come either way, but potentially there's an opportunity to even now to try it and see how things go. I'm a big promoter of let's start small, try it, see if it works, adapt.
Yeah. Oh, well, if there's anybody from that area, if you're interested, just put that in the sidebar and we can maybe let Paula know, because that's another option, isn't it? Just for that kind of sector. But anyone got any? Oh, Tracy from Te Ata. Have you got any comments or questions?
Oh, I just think that's a fantastic idea. To have a wide range of people coming into contact with a wide range of community services. We are mental health peer support, and yeah, I mean, I'd be really keen to have something out the front of the hospital and say, hey, here's an option for mental health support that you might not know about, or it sounds like a great idea to me. Yeah, thank you.
Paula, is that something you were talking about, maybe having a roster or something? And for example, you might have a bit of a roster and one group says, for example, Tracy said, look, we'd like to come on Wednesday morning at 10 o'clock for an hour or two, sit there with our pamphlets, people can approach you, and also an option to have maybe a board with some information or something.
Yeah. So, yeah, I can see a couple of options, and there's no harm in trying things to see what works. Is that rostered times over a 2-week period or something like that we make sure the wards know about, that we give to patients and potentially visitors that come in if it's relevant, and or kind of having some days or an afternoon where there are multiple services present, which is sort of similar to like we're having this period of time, or both.
Right. I don't see, we might have a few people putting stuff in the chat, I think. No other comments. I think you've got a bit of encouragement there, Paula. I think that's probably for some people, they need to go back to their organisations maybe and talk about whether they have the resource for someone to come and sit there, whatever. So,
and I'd probably lean on Tracy to help coordinate this. Yeah,
definitely. Well, I've got Sarah from Flying Kites, is great idea. So that's good. So, I mean, we think at HealthLink, we think it's a really good idea, because that voice goes two ways, doesn't it? Community feeding back, but also our NGOs making sure that they are getting their message out to our community about what, I suppose, complementary services to the to primary health, sort of secondary and tertiary health, makes a big difference when our staff can also know that when people leave a hospital or a service, they can say, look, with what you've got going on, these might be some options for you to contact. It just helps people to get further support once they're out of the main system. And we've got Natalie from ME says that certainly sounds a great concept. So I think you haven't got any objections so far. It's small feedback, Paula, but I think not everybody warms to things immediately. Some people like to cogitate for a while, so that's great. Was there anything else? Did anyone have a question of Paula around anything? There's no silly questions. What's that?
We've got Pauline with their hand up.
Pauline, please. See, I couldn't see that.
I apologise. I'm on a new Zoom thing, and I can't find the hand, so I do apologise.
That's okay, Pauline.
My question is, if a timetable was made up, would the NGOs then bring their own material, their own resources and flags and things, or would there be an area where they could leave them, or how would that work?
I think you'd have to bring your own flags and things. We don't have a lot of storage on site, so and to store multiple NGOs information would be a bit tricky. So absolutely, if you've got things that you would bring, that would be fantastic.
And the other question was, what would the time, would it be monthly that you would be looking at having NGOs change over?
Well, it's open to the floor. I would probably say you have a slot, depending on how many people are involved and how it works, and I'll need to get feedback from our team as well. Like you might come once a month or once every 2 weeks. Just sort of depends on the need. We do have a reasonably high turnover, and our patients, our staff obviously are different, but if there are visitors that want to come in that say a parent has had a stroke and then they decided to look at the Stroke Foundation that was on a certain day, that's where the advertising would come in, so we'd make sure the charge nurses know about it to disseminate to their teams and patients.
Oh, thank you.
Right, thanks for that, Pauline. And I think there's the two different things. There's the full-on NGO forum where there's kind of the tables and everything, and then there's that other option of come in, do your slot for an hour or two, sit in that foyer maybe with your information, then go away. Then another group might come, you know, and it just might flow over the week. You know, it just means that it could be, if there was enough interest. I think that's what you're kind of saying, aren't you, Paula?
Yeah, and it might be, and I'll talk to Tracy about this, for those that are keen, there might just be a few to start with, and we can see how it works. There's always some learnings.
That's right. Now we've had another comment, love the idea, from Eileen Zhu at Asian Health Service. It'd be much help, it'd be if we can get NGOs from multiple cultural backgrounds as attend as well. So it's just like everybody, which is great. And then someone says, is there any possibility to have a day specifically for Asian ethnic refugee services? So you're asking, you know, maybe you could you know, have a theme day as well.
Theme.
Yeah, so that's another option. That's great. Sorry to the people I've just admitted I was busy navigating the participants, the messaging and everything, and I didn't see you. I'm very sorry. So, all right, Paula, are you happy?
Yep. I'll leave it with it will need to be because the space we're using is now where the shop is, because the shop's going to move into the shop space, into the Well Foundation space. So that's the space we're looking at. So I'll be in touch with Tracy, and we'll sort out what a roster could look like, and maybe Tracy, if you send out something to the groups so people can register their interest.
Yep.
Yeah, I can do that.
Yeah, because I've got a question there. How do we register our interest? So Tracy will send something out to the whole database to say, are you interested? And that way we can get a group of you and have a free-flowing back and forth till we work it all out. That's great. Thank you so much, Paula.
So I just wanted to add, in the open days, you just, you know, because the space is so limited, mainly people come with a banner and to stand there with a basket of information or some brochures, and it would sort of be limited to that. You wouldn't be able to really bring a table and any of that stuff, because it just clogs it up. So it's really just about touching base with patients, visitors, staff, and then following up once you're left, I think.
Yeah. And Edith asked a question, where's the shop? So if you go into the main entrance, and on the right is the sort of reception, and just behind the reception, there was a space where the Well Foundation is, which was the fundraising foundation for both hospitals. They vacated there. So I think that's where it is, isn't it, Paula? It's sort of in behind there on the right, kind of opposite the cafe.
But it's currently, and it just sells knitwear and things like that. That's currently to the left, and that's kind of
the left, yeah. But so you're going to move it over to the right.
Moving.
Yeah.
That's where it used to be.
Yeah, used to be, yeah. So that's answered that question. All right, well, thank you so much, Paula. That's really helpful, and hopefully we get lots of interest. Make that entrance a bit more people friendly, you know, when people see familiar faces from the community in there as we're coming in, as well as the lovely receptionists. Thank you very much.
What about the timing?
Oh, timing. Oh, no, we can't let you go yet. Tracy's got questions.
I'll need to confirm that because I haven't yet had the start time. I know we've got some of the some things that have come in, but there are a couple of things that need to happen first. So I'll confirm that with you.
Thank you. That's great. Thanks very much, Paula, for your time. Now, when I said turn pictures off, I didn't mean everybody else. So would love to see your faces again, everybody. It was just Paula because she had low bandwidth. So we're going to go back to now, and welcome to people who've just joined. We're going to go back to our long-term conditions. So we've still got Disability Connect, Hospice, ME Support, Your Way Kia Roa. If you can put your virtual hands up, I can't even find where that is now on the changed thing, if anyone can let me know, because I've changed the format here. So we have Natalie here from ME Support. So you're first, Natalie. Welcome.
Hi, can you hear me okay?
Yes, perfect.
Lovely. Kia ora, I'm Natalie Newell from ME Support, previously ME Auckland, and I'm here, I'm Client Support Coordinator, and we basically support people across New Zealand and particularly within the Auckland region with ME, CFS, long COVID and fibromyalgia. I'm just going to read you a little bit of a blurb, if that's okay. Over 45,000 New Zealanders are affected by ME, CFS and long COVID. ME Support, formerly ME Auckland, is a charity helping New Zealanders with myalgic encephalomyelitis or chronic fatigue syndrome, ME, CFS, long COVID, their whānau and carers. Our mahi is to provide free support to people with ME, CFS, long COVID and fibro. All of our members are able to access an online symptom management resources, information and access to our national Facebook support group, as well as online support groups, presentations and events. And also our Auckland members have access to our one-to-one client support coordinator service. Just due to capacity, we're not able to offer that to our members outside of Auckland, but obviously as this is an Auckland regional service, that won't be the case here. And we also offer a face-to-face meeting once a month in West Auckland, based at Ranui Community Ranui Community Centre. Yeah, so that's a little bit about us, and you can contact us via www.mesupport.org.nz, and people can join free as a member through our website, so you can refer them through if you have anyone that needs some support.
Thank you very much, Natalie. And if anyone in their presentation wants to put any information in the sidebar, please feel free, and we collate that. Now, I don't seem to have Disability Connect, Hospice or Your Way Kia Roa. If any of you are here, haven't seen a virtual hand up. So if those people come later, I'm going to, we'll slot them in later. So next group is Mental Health Social Services. We've got an apology from Robin from Real World Living. So Man Alive and Perinatal Anxiety Depression and Te Ata can put their hand up if we're here. Got, oh, Jonathan. And Jonathan is from, Jonathan, where are you from?
Man Alive.
Oh, great, thank you. We normally have Jose, so right, well, you're first, so away you go. Thank you.
Well, thank you for having me. So kia ora, my name's Jonathan, filling in for my manager, Jose, here at Man Alive. We're in the youth department. So we support youth, but the majority of the work we do is with boys, although we are expanding to supporting youth girls as well, but we'll talk about that in a second. So the age range is, it's a counselling service, so it's the age range is 8 to 24 here in West Auckland. We have other branches, but you can check that out on our website. I'll put our information on the sidebar later after this. So the programs we have are Boys Alive, so that's an 8-week program. It's anger management, but it's also mentorship. And we take the boys through a range of challenges and support with their mental health. The flagship activities are things like Parakai and Sunshine Camp, which is like overnight camp we take the boys on. So lots of fun, lots of challenges, getting them out of the house and off their devices, which is always good. We also have a Growing Men program, which is for one-on-one counselling specifically for anger management. So that's individual sessions. We also have a youth general counselling program. So that's again one-on-one, and that's dealing with a range of other issues that we all face: depression, anxiety, bullying in schools, sexual abuse, drugs, alcohol, parental separation, and sexual identity or transition. The Boys Alive in Schools program, who Jose and Wayne manage, is a fantastic program supporting youth, which is the youth program I mentioned before, which is now helping support the girls and the boys in years 8 and 9 transition from intermediate into high school. So making that big leap, right? So that's in Waitakere, Massey High School, Dombuck, Lincoln Heights, Massey Primary, and Swanson. Those are 5 sessions, so once a week. And then the Boys Alive program will start up again on the 16th of October. We didn't have enough numbers, unfortunately, this term, but we're going to start again. That's an 8-week program. And so that is from 4 till 6 in the evenings, Wednesday evenings. And if anyone has any questions about the programs or anything, I'll put our info in the side. And yeah, thank you for your time and letting me share a bit of that stuff.
Oh, kia ora, Jonathan. That's great. All right, so we now have Tracy from Te Ata. Welcome.
Thanks, Linda. Kia ora koutou. Yeah, I'm Tracy. I'm the coordinator of Te Ata. We are, like I mentioned, mental health peer support. Been going for 20 years, and we're a joint venture between Te Whatu Ora, what was the health board back in the day, and the charitable trust that runs the organisation. So we run programs, a wide range of programs. We have a drop-in centre at in Keeling Road in Henderson, and run programs that are based around mental well-being, really, or the determinants of well-being. I'll just run you through them. So we've got slow cooking, guitar, yoga, art, motivational movement, which is dance therapy. We have free food once a week, craft group, poetry, computers, watercolor painting, karaoke, and pool on Fridays. So we've traditionally had kind of wider well-being and recreational activities, and we're moving towards more some more structured peer support groups as well, recovery peer support groups. So we've got a structured 10-week peer run recovery support group going, and just also looking at looking at running a group for male survivors of sexual abuse. So more of the direct supporting people with more of the direct impacts of mental illness or mental health challenges. What else about us? Yeah, I mean, our point of difference, I suppose, is that we're peer run. So all our staff, we've got staff that are Chinese, Samoan, Maori, European, and a whole range of volunteer tutors, and we all have our own experience of recovering from mental health or addiction challenges. So yeah, which is, I guess, our main point of difference. Yeah, and that's about it, really. Yeah, based in Keeling Road. Just adapting to, at the moment, we're kind of growing and adapting to the changing needs of the community, like an aging population. So looking at what programs and groups we might be able to provide for older adults, but also location wise, we're just at the end of the road from the Kahui to Kaha transitional housing. So now that we're getting known around there, we've got a range of different kind of mental health and social kind of needs that we're trying to figure out. So what programs can we run to support people? So we basically exist for our members, meeting the needs of the people that walk in the door. So yep, that's us. Thank you.
Thank you, Tracy. Kia ora, that's great. All right, so now we've got Yasa from Kahui to Kaha, as you just said, one of your neighbours. So welcome, Yasa.
Kia ora, Linda. Thank you very much for having us. My name is Yasser Rachel. I'm a service manager for the Muslim Mental Health Service in Kahui to Kaha. And we have here also
Kia ora, my name's Jennifer, and I am a service manager for the primary mental health services in Kahui to Kaha.
Salam alaikum.
Alaikum salam. So we covering Kahui to Kaha is a not-for-profit organization, and we work for providing mental health and social housing. And we covering basically all Auckland, and specifically also we work in Waitakere. We have also the refugee settlement service contracted by the government to settle the refugees in Auckland. And we work under the mental health, we work with the former refugee, and we part of the ethnic health collective, the new one arriving to see how we can support basically the government for the new direction. And so yeah, we have specific mental health services for Rangatahi too, and housing service for Rangatahi. For mental health, we have Maori mental health, specific mental health, Muslim mental health. We have Afiora, which is primary here, Jennifer just managing it.
And Asian.
And also we have Asian mental health services. We have also the counseling service just next to Waitakere Hostel. It's a big sign there for Kahui to Kaha. So yeah, that's what we provide under our contracts here. If you have any question, we're here to support just your kubaba and what
Thank
you do.
you.
Yeah.
And also we're just saying, I mean, if you're working in the youth mental health space, we'd love it if you had a bit of time to join our forum with Samantha, who's leading that, just to offer your wisdom around, you know, that particular, you know, the particular challenges for Muslim youth with their mental health challenges. That would be fantastic. Thank you. All right, so now we're moving on to community health. So if the community health group, so that's Redland, Citizens Advice Bureau, Ada, Dana, Jeanette, Sally, and Samuel, if you're here, if you can pop your virtual hands up. And if anyone can tell me, where is the hand thing now on this new forum? I can't find it. I was getting pretty good at all this. I can lower it, but I don't know how to put it up. Anyway, okay, so who have we got? Anyone put their hand up yet? No one else can find it either. Okay, so I'm just going to call the names out. So Redland, are you here?
Yes,
Great.
I'm here. Can you hear me?
Yes.
everyone hear
Oh,
me?
you've got your hand up. Yay.
Yes.
It's just the way I've got this set up. There we
Kia ora,
go.
Linda. Kia ora,
Welcome.
everyone. My name is Redlawn, but everyone call me Red. I think Red is shorter and it's better. I'm here from the AAF, which means Aotearoa Africa Foundation. We service the ethnic communities, mainly the African communities. And we have a range of services, and which includes social support services, advocacy in terms of social housing, and advocacy also in terms of social welfare. We also provide social support, like food support on Saturdays, free food to the communities. And we are actually located at 208 Richardson Road in Mount Roscoe, so not far from Avondale and not far from Mount Albert. and that's where we are. We also have a youth program on every Saturdays where we teach young people about leadership and some activities as well in terms of like health and well-being activities to keep them healthy. We also offer social work practicum opportunities, which we currently have some students who just finished last month doing their practicum with us. And yes, in general, that's a little bit of what we do. And yes, we're located in Marosco. So if you have any questions, and we like to partner also with any other community organizations, we're more than happy to do that. And yes, thank you so much.
Thank you, Red. I know you're based in Mount Roskill, but I mean, you're working out here. If you, just the previous question I asked Yasa, if you know, you've got any particular insights into your youth mental health, the people that you're coming across, we've got a forum in August. We're not asking anyone to share anything confidential, just trends, you know, what's happening. So if you're interested in being involved in that, it might be only an hour, a couple of hours of your time. Let Tracy know. That it would be so valuable if we could get a general. I mean, I think you can get statistics, but when you get actual stories or even just trends from the people who are working at the coalface, it gives a really good picture of what is going on in our community if we join together to get that wider picture. It's always more powerful if we're looking for support and more support, funding, whatever it is, if we can demonstrate, you know, this is what's happening, for example, for our young people. I think, anyway, that's my pitch. I'd love people to get involved.
Yes,
So,
Linda, we would like to get involved. I think from our last meeting, I did agree to participate in it. I think it was mentioned in our last meeting about that research. And yes, we're more than happy to participate in it. So yeah, yeah, we just love to hear and how we can get involved and how we can get to get young people to share their stories.
Great. Oh, well, Tracy will note that for our list. And then we'll be getting Samantha to contact. So thank you so much. That's great. So the next hand up I've got is, actually I'll just ask. So we've got, is anyone from Citizens Advice Bureau here? Liami, I don't think so. So then Edith is next from Maternity Service Consumer Council. Welcome, Edith.
I'm just checking that you can hear me properly.
Yep.
Okay.
And yep. Great.
So
thank you.
It's such a mouthful. I wonder who came up with that name. Maternity Services Consumer Council, so MSCC, founded in 1990. At the time, this was a relationship with the Auckland Health Board, who basically got a whole lot of groups together that had anything to do with maternity and just asked them for their ideas about going forward in the future, what was needed, etc., etc. And they realized pretty quickly that there was no way they could communicate with all these different groups. So this is how MSCC came to be. We were sort of like the umbrella that sort of talked to all these people and then reported back to the health board. Of course, today there's very few groups left. In fact, there's virtually nothing. In fact, I don't know if you people are aware, but maternity in our country is at absolute crisis point. We have a shortage of midwives of only 40%. I mean, honestly, it is really, really bad. So what we do is we write those submissions, we go to those meetings, we talk to people, and we also support midwives. But what we really want to do is get information out there in the community that basically gives them truth about all these interventions that happen to women when they give birth, all the intervention that happens to them when they're actually pregnant. Because unfortunately, and this is maybe due to the fact that we have smaller families and we're also very interested in learning this way, we don't really get very good information this way. You get much better information when you research, which is of course very hard to do. So we've done the research, put it all together, and we've got 12 printed resources that women can order individually from our website, and they're also ordered by midwives, by childbirth educators, by doulas. And it helps women to ask those pertinent questions of their care providers. It also empowers them to know, actually, I can do this because I'm actually designed to give birth to my baby. So no, thank you. I don't want to have a C-section. Currently, our C-section rate sits well over 30%, which is just not sustainable. So yeah, we're quite passionate, but at the same time, we're also very tired because at the end of the day, folks, all of us started our lives in maternity. All of us, regardless of race, regardless of sex, regardless of pronouns, none of that matters. All of us started life in maternity, and yet maternity is simply not respected. And every day in our country, 50 women are left traumatized by their birth. And I hear a lot of you deal with mental health. So you've heard some stories why that is. And so many women today actually decide, I am not going to a maternity environment. I am going to free birth because they cannot bear the thought of these people touching them. And that is tragic. Yeah. So yes, so it's about providing information to the community and hopefully empower women to make choices that are right for them and their families. And that's what we do.
Thank you, Ada. That's great. And I know Ada's been, we met when we were La Leche League leaders years ago, and now our children are all grown up. And so thank you, Ada, for your advocacy for women giving birth. Okay, so next we have Dana from New Zealand African Community Health Services. And Ada, just pop your stuff in your website in the sidebar in the chat, it would be great. So Dana, are you still here?
Oh, yeah. Thank you for having me here. Hi, everyone. I'm Dana from African Community Health Services. Oh, well, African Community Health Services is a charitable organization based in Auckland and Wellington at the moment. And we are committed to improve the health and well-being of African and African women by improving access to important health services. Our key services include health promotion and also as well mental health support for individuals, and also as well we provide health prevention through the screening organization, the vaccination also as well. And right now we have African Women Health Support Group that the purpose is to improve the maternal health and health outcome of African women here in New Zealand. And also promoting the culturally sensitive care also as well, because it's something really important for the maternity. And yeah, we also engage through the community through our weekly social media, where we share some health type, event, and also success story. Oh, thank you. Yeah, this is a cute overview of the organization.
Thank you, Dana. That's great to hear from you. I think this is the first time your organization's been here.
Oh, yeah,
memory. Yeah, well, welcome. That's great to hear you've got that. And you touched on the maternal health of your woman as well. So there's some real synergies with, and that's why we do this, partly to let our health providers know, but to let all of you know what else is out there and how you can work together. There's often crossovers and synergies that can help each other. So thank you so much. It's great. Now, have we got Jeanette here from Presbyterian Support Northern? Haven't seen you. So we'll go to Sally from St. John. Hatahone. Welcome, Sally.
Hello, Linda. Nice to be here. Nice to see some new faces too. That's fantastic. Really good organisation. So it's lovely hearing about all the work you do out in the community. Look, St. John's too big to talk about in 30 seconds. So if anybody wants to know about the multitude of services at St. John, there's a number of volunteering opportunities that some of your groups may be interested in volunteering. My particular role is in educating health professionals about St. John medical alarms. And so mainly that's done in hospitals or practices, medical practices, NGOs, etc., to teams of health professionals who may be talking to people that would be relevant for a medical alarm. So I cover the whole of Northland and half of Auckland. So the west of Auckland, north of Auckland, and parts of central Auckland. So please, I'll put my details in the chat. Just call me about that. But there are a number of other volunteering services and other services out in the community, like our caring caller, friends of the emergency department, therapy pets, etc. So go onto our website if you're interested in finding out more of that information. And if about medical alarms, just call me. Thank you. Thanks, Linda.
Thanks a lot, Sally. Nice to see you. All right, so we've actually got our Asian Health Services staff here. So because we've got time, I think it's Eliane will talk to us about you know, what they do. So welcome, Eliane.
Hi, Linda. Thank you. Kia ora, everyone. I'm Elaine from Asian Health Services, Te Whatu Ora. We are a service managed directly by Health New Zealand, Te Whatu Ora. At this stage, our office are based at North Shore Hospital and Waitakere Hospital. We have mainly 4 divisions. One is Asian Patient Support Service. We provide inpatient support to the patient who are who are receiving services in North Shore and Waitakere Hospital. We also support their transition for discharge planning, and we work with MDT for the like follow-up as well. And we have Asian mental health services. We cover secondary mental health patients who are under Waitemata secondary mental health services. We provide cultural support, and also we also have a counseling psychological session, culture appropriate psychological sessions, and we do workshops as well, mental health workshops in the community. And the third division is our what is interpreting services. This is we provide 143 languages at this stage and covered by more than 200 interpreters. Our interpreting services cover 24 hours for all the hospital appointment, and also like consultant and outpatient clinic as well. We also have a primary interpreting services cover GP clinic, most of the primary health clinics in Waitemata area. And the third division is Asian Health Line. Actually, this is the most important information for our community people, because Asian Health Line cover nationwide Asian and ethnic communities. We can receive any phone calls, like health-related phone calls, and also we can navigate them into appropriate services. We also do like referral to other community agencies as well. So we work closely to lots of like community NGOs for the health services for our Asian and ethnic community. And we also have a project called Health Mother, Health Future program. This mainly cover like a pregnancy, Asian ethnic pregnancy women, and also including the including the women with babies up to 1 year old, mainly focus on mental health, like if they have stress, or if they just want to talk because of too much stress, they can call us and we can do like assessment, and we also can provide where to get further support. And sometimes we also communicate with the secondary mental health for referrals as well. We communicate with GP as well, but at this stage, this face-to-face support only available within Waitemata area. For other area, like we mainly provide information and referral services. that's basically, yeah. Like, oh, I forgot to mention our Asian Health Line. We cover lots of GP booking. If they have communication barriers to access their GP services, we can help them to sort out their booking, their interpreting arrangement, something like that. And also we can help all the community people to access our national immunization program, and also our health screening program, especially for breast screening, bowel screening, those kind of national programs as well. Thank you, Linda.
You. Thank you, Eileen. And also just a little bit of a, quite proud that we were the only DHB that had Asian Health Services.
Yeah.
So Waitakere was leading the way in that. I don't know whether it's going to be rolled out over the country or not, or in the areas where you have high Asian populations, but that would be great, wouldn't it? Anyway, thank you so much. That's great. So we are at the end of our report backs. I want to thank everybody for that. I'll just quickly go over my general updates again, because some people might not have been there, but just to say our AGM for WHL will be 1 p.m. at Te Pai. Guest speaker Hector Matthews, who's Director of Consumer Engagement Whānau Voice, Health New Zealand Te Whatu Ora. And we've set him the task of explaining the health system working for you. How can consumers and communities be part of planning and decisions about their health? We don't want to let go of that easily. So we're keeping going, pushing the people who are working in the system to tell us how that's going to happen, and making sure they know that we want that. And we'll have great catering too. Good catering we had last year. So there will be something to eat and drink, and we'll have a great guest speaker. Now, we did write a letter to the Minister of Health to ask him about that. How are we going to get our voice in health? And we got the generic reply, but he must have passed it on to the head of planning and commissioning, which is funding. And he said, basically, hold your horses, just watch this space. So we still haven't had a definitive reply on how that's going to happen, but we're not going to give up, because we think that our voice in health is really important, and that it shouldn't be so far away from us that we can't all contribute as organisations and consumers. So there's that. I think that was all. The Youth Mental Health Program. So we're going to finish early today, so you can get sorry.
Question.
Oh, question. Sorry.
The date of the AGM. So.
Oh, the date. Sorry. That.
The date.
Sorry. Okay. Sorry. Maybe I speak too fast. It's 1 p.m. 24th of September at Te Pai Netball Courts at the Te Pai Centre on Moselle, is it? No, Te Pai Place.
Netball Courts. Yeah.
Netball Courts, Te Pai Place, 24th of September. We will be sending.
I'll put it out in the
we'll
notes.
Be putting it out in the notes, and you can if you just RSVP to us, so we know how much food to get. So that'd be great. All right. Well, thank you. I'm going to just close up here with the karakia, kia whakaere te tapu, kia wātea te ara, kia tūru ki whakatae, kia tūru ki whakatae, haumi e, hui e, tā he ki e. Thank you, everybody. Have a great day, and we'll see you next time. Thank you.
Thank you. Bye-bye.
Bye. Thanks
Thank
for
you.
contributing.
Thanks,
Bye.
Linda. Thanks, Tracy. See you later.
Bye.
Thanks, Jess.
Thank you.
Bye.